Have you ever checked your blood pressure and felt a sudden wave of panic just by seeing a number? Maybe it was slightly higher than expected, 140/90, 150, or even more, and instantly your mind races with worst-case scenarios, imagining heart attacks, strokes, or permanent damage, and in that moment your body feels like it is already under attack. This reaction is incredibly common, and over my 32 years of practicing preventive health and metabolic wellness, I have seen this countless times. People often believe that a single reading defines their health, but in reality, blood pressure is dynamic and influenced by a range of factors that change throughout the day. Blood pressure fluctuates naturally, depending on sleep quality, hydration, stress levels, physical activity, and even recent meals. Research from the National Institutes of Health shows that healthy individuals can experience swings of 10-20 mmHg during a typical day. Yet most people interpret each reading as a final verdict on their health, which is misleading and can generate unnecessary anxiety. One high reading should never be seen as a sentence. Instead, it is a snapshot, a small piece of a much larger puzzle. I recall a patient named Mark, 42 years old, relatively fit, who came in after a routine checkup showed 148/92. Immediately, panic set in. He began monitoring his blood pressure multiple times daily, morning, afternoon, and evening, each time worrying about small fluctuations. Within 2 weeks, his readings became unstable, not because his health had worsened, but because anxiety itself was affecting his physiology. This is a phenomenon known as white coat hypertension, where stress and fear temporarily elevate blood pressure readings. According to research in the Journal of the American College of Cardiology, up to 30% of patients experience elevated readings due to anxiety during measurement. The American Heart Association also emphasizes that the sympathetic nervous system, the part of our body responsible for fight-or-flight responses, can spike heart rate and blood pressure during moments of fear. Essentially, the more you worry about your numbers, the higher they can go, creating a vicious cycle. Blood pressure is never an isolated metric. It is a reflection of multiple physiological systems interacting simultaneously. While a single elevated number may grab attention, it often tells us more about temporary conditions than chronic risk. Doctors evaluate patterns over time because context is everything. The European Society of Cardiology recommends averaging multiple readings across days or weeks to form an accurate understanding before making any medical conclusions. Temporary spikes in blood pressure are not inherently dangerous. The Lancet reports that long-term cardiovascular risk is associated with chronic high blood pressure, not occasional elevations caused by stress, caffeine, or physical activity. Think of blood pressure like pressure against a wall. Pressing for 1 second does nothing, but sustained pressure over hours or days creates strain. Our blood vessels behave similarly. Short-term fluctuations are normal, but persistent elevation is what increases risk. Lifestyle plays a decisive role in stabilizing blood pressure over time. Diet, physical activity, sleep quality, and stress management influence both short-term readings and long-term cardiovascular health. The World Health Organization highlights that improving these factors can dramatically reduce the risk of hypertension-related complications, sometimes even more effectively than medication alone in early stages. Understanding this is essential for taking meaningful control over your health. Let's consider another patient, Sarah, 55, who consistently had perfect readings, 120/80, but lived a high-stress lifestyle, slept poorly, and rarely exercised. Over time, she developed metabolic issues that increased her cardiovascular risk despite her normal blood pressure. This example illustrates that numbers alone do not define health. They must be considered alongside lifestyle, metabolic function, and stress levels. Blood pressure is a signal, not a verdict. Controlling anxiety and stress is often overlooked but crucial. Chronic stress keeps the body in a heightened sympathetic state, raising cortisol and adrenaline levels that elevate blood pressure. Studies in the journal Hypertension demonstrate that interventions like deep breathing exercises, meditation, mindfulness, and consistent physical activity can effectively lower long-term blood pressure. Focusing on these habits provides stability, rather than obsessing over every reading. The first practical step to take is to stop obsessively checking your blood pressure multiple times per day. According to the Mayo Clinic, taking readings consistently, at the same time each day, and in a relaxed state produces far more accurate trends. The goal is to measure your health over time, not to react emotionally to temporary spikes that are entirely normal. By understanding patterns rather than fixating on numbers, you begin to take real control of your cardiovascular health. Once we shift focus from individual numbers to long-term trends, a remarkable thing happens. anxiety reduces, and blood pressure begins to stabilize naturally. When patients like Mark follow this approach, the readings we once feared start reflecting a healthier baseline. This aligns with research from the British Journal of Nutrition, which shows that consistent dietary improvements, more whole foods, fruits, vegetables, and reduced sodium, can lower blood pressure over time. The key here is consistency, not perfection, because small, sustainable changes accumulate, affecting not just numbers, but the overall health of the cardiovascular system. Equally important is understanding the impact of sleep. Poor or inconsistent sleep is a silent contributor to elevated blood pressure and metabolic dysfunction. According to the National Sleep Foundation, adults who sleep less than 6 hours per night experience higher average blood pressure and greater heart strain over time. Sleep deprivation triggers hormonal imbalances, increases cortisol, and can amplify stress-related spikes in blood pressure. When patients improve sleep quality, even moderately, their blood pressure readings often drop, sometimes dramatically, without any medication. Physical activity cannot be overlooked. Engaging in regular movement, even walking, swimming, or light resistance training, strengthens the heart, improves vascular elasticity, and reduces long-term blood pressure risk. A meta-analysis in the American Journal of Clinical Nutrition found that aerobic exercise lowers systolic blood pressure by an average of 5-7 mmHg, comparable to low-dose medication in mild hypertension cases. The body is designed for motion, and movement directly counteracts the stress-induced spikes that most people react to emotionally. Stress management is equally critical. Chronic stress elevates sympathetic nervous system activity, increases catecholamines, and drives blood pressure higher. Mindfulness-based interventions, as reported in the journal Hypertension, have demonstrated reductions in systolic and diastolic pressure by an average of 4-8 mmHg. Incorporating simple practices like deep breathing, meditation, or even short walks during breaks can have profound effects when applied consistently. Hydration and diet are subtle but powerful influences. Excess sodium intake, sugary beverages, and highly processed foods create inflammatory responses and fluid retention that elevate blood pressure. Conversely, potassium-rich foods such as bananas, spinach, and beans help regulate vascular tone. Research from Harvard T.H. Chan School of Public Health confirms that a diet emphasizing whole foods, low sodium, and high potassium correlates with lower average blood pressure and reduced cardiovascular risk. These changes are foundational rather than reactive, offering long-term benefits that a single reading can never convey. Many patients misunderstand medication as a first step rather than a last resort. While antihypertensives are life-saving when necessary, lifestyle modification is often the more powerful tool in preventive health. The Mayo Clinic notes that consistent lifestyle improvements can delay or reduce the need for medication in many cases. This approach not only stabilizes blood pressure but also improves metabolic health, mental well-being, and overall resilience. Another common misunderstanding is that high blood pressure always produces symptoms. Many people assume if they feel fine, there's no problem, or conversely, if they feel anxious, their numbers must be dangerously high. This misconception is why pattern recognition and proper measurement technique are critical. White coat hypertension and masked hypertension are examples of conditions that can mislead patients unless monitored appropriately over time. Let's return to Sarah's story. Despite normal readings, her lifestyle placed her at hidden risk. Only by addressing sleep, stress, and activity patterns did her long-term cardiovascular risk decrease. This example highlights that blood pressure numbers are indicators, not determinants. Effective health strategies focus on the underlying system rather than obsessing over one isolated metric. Tracking trends effectively involves simple steps. Measure at the same time each day, use proper posture, avoid caffeine or exercise before measurement, and record readings systematically. According to the European Society of Cardiology, averaging multiple readings over weeks provides the most accurate picture. Many patients find relief simply by knowing that their blood pressure is being assessed methodically, rather than reactively, which reduces anxiety-driven spikes. Ultimately, understanding blood pressure in context empowers patients. The body communicates through signals, and numbers are part of that language, not the final story. As research in The Lancet and other journals emphasizes, focusing on long-term stability and lifestyle factors produces far more meaningful results than chasing perfect numbers. Patients who adopt this mindset experience less stress, better metabolic health, and improved overall quality of life, proving that understanding beats obsession every time. Another overlooked factor in blood pressure management is mental health. Depression, anxiety, and chronic stress contribute significantly to sympathetic overdrive, elevating cortisol and adrenaline levels. Research published in the journal Hypertension highlights that individuals experiencing chronic psychological stress have an increased risk of developing sustained high blood pressure over time. The takeaway is clear. Managing your mind is as important as managing your diet or exercise routine, because the two are intimately connected in regulated cardiovascular function. Social support also plays a subtle but measurable role. People with strong social networks tend to have lower stress levels and better blood pressure control. A study in the Journal of the American Heart Association found that individuals with positive social interactions exhibited healthier cardiovascular markers and lower rates of hypertension progression. This demonstrates that health is not only biological but also influenced by our environment and interpersonal connections. Many patients ask me if occasional indulgences, like coffee or dessert, are dangerous. The reality is that temporary spikes caused by such habits do not predict long-term cardiovascular damage. According to research from Nature Metabolism, short-term dietary or stimulant-induced blood pressure changes are normal and rarely harmful. The key is moderation and consistency, focusing on the overall pattern of lifestyle rather than individual moments. Alcohol consumption is another factor that often confuses patients. Moderate consumption can sometimes be neutral, but excessive or binge drinking can elevate blood pressure chronically. The CDC reports that regular heavy alcohol intake increases both systolic and diastolic pressure and contributes to long-term cardiovascular risk. Patients who reduce intake, even modestly, often see measurable improvements in their readings and overall health metrics. One of the most powerful but overlooked strategies is daily movement, even outside formal exercise. Standing breaks, walking meetings, and short stretching sessions reduce sympathetic stress and improve vascular tone. Studies in the American Journal of Clinical Nutrition show that cumulative daily activity, not just formal exercise, can significantly lower blood pressure over months. The lesson is that small habits add up, and consistency is far more important than intensity alone. Nutrition remains central to long-term blood pressure stability. The DASH diet, endorsed by the National Institutes of Health, emphasizes fruits, vegetables, whole grains, lean protein, and low sodium. Clinical trials demonstrate that patients who adhere to DASH experience reductions in systolic blood pressure by an average of 8-14 mmHg within weeks. This is comparable to starting low-dose medication and highlights the power of nutrition as a first-line intervention. Weight management is intrinsically linked to blood pressure. Even modest weight loss, 5 to 10% of total body weight, can produce meaningful reductions in systolic and diastolic readings. Research from Obesity Reviews confirms that weight loss improves vascular elasticity, reduces inflammation, and lowers risk for metabolic syndrome. This emphasizes that sustainable lifestyle change, rather than drastic or temporary dieting, is key for long-term cardiovascular health. Hydration and electrolyte balance are subtle but impactful contributors. Dehydration triggers hormonal mechanisms that retain sodium and increase vascular resistance, subtly raising blood pressure. On the other hand, sufficient water intake and potassium-rich foods help vessels relax and maintain stable pressure. Harvard T.H. Chan School of Public Health reports that these small adjustments, when practiced consistently, support overall cardiovascular function and resilience. Sleep consistency continues to play a crucial role. Irregular schedules, night shifts, or fragmented sleep can disrupt circadian regulation of blood pressure and hormonal balance. Research in the journal Sleep indicates that individuals with stable, sufficient sleep patterns have lower long-term blood pressure and reduced incidence of cardiovascular events. Patients who prioritize sleep, even over minor lifestyle adjustments, often see significant improvements in readings without medication. Another factor often underestimated is environmental stressors. Noise, pollution, and high-pressure work environments all activate sympathetic pathways and elevate blood pressure temporarily. Studies in the BMJ have linked chronic exposure to these stressors with higher long-term cardiovascular risk. Recognizing these external contributors allows patients to take practical steps, like short breaks, relaxation techniques, or lifestyle adjustments, to mitigate their impact on blood pressure. One of the most overlooked contributors to blood pressure fluctuations is caffeine. While moderate intake is generally safe, excessive consumption can temporarily spike systolic and diastolic pressure. Research from the American Journal of Clinical Nutrition shows that regular caffeine users often develop tolerance, but sporadic intake can still create sudden spikes. For many patients, simply tracking caffeine and moderating intake leads to more stable readings without affecting overall lifestyle enjoyment. Smoking, on the other hand, is a non-negotiable factor. Nicotine acutely raises blood pressure by stimulating the sympathetic nervous system and causing vasoconstriction. According to the Journal of the American College of Cardiology, Smokers have a 20–30% higher risk of developing hypertension over time, and cessation results in measurable improvements in both systolic and diastolic pressure within weeks. This is one area where immediate action has long-term tangible benefits. Another subtle influence is posture during measurement. Blood pressure varies based on body position, sitting, standing, or lying down, and arm placement can skew readings. The European Society of Cardiology recommends measuring at heart level after 5 minutes of rest and avoiding talking or distractions. Many patients see artificial spikes simply due to improper technique, emphasizing the importance of proper measurement for accurate interpretation. Emotional state at the time of measurement plays a major role. Anxiety, frustration, or excitement can temporarily raise blood pressure, sometimes by 10–15 mm Hg or more. White coat hypertension, as noted in the Journal of the American College of Cardiology, occurs in up to 30% of patients due to fear of medical evaluation. Learning to measure in a calm, relaxed state is often the first step in reducing variability and gaining confidence in your numbers. Even weather and temperature can influence blood pressure. Cold environments cause vasoconstriction, raising pressure temporarily, while hot climates can lead to vasodilation and slightly lower readings. Research in circulation reports seasonal variation in blood pressure, emphasizing that context matters. Understanding these small influences helps patients interpret their readings rationally and reduces unnecessary anxiety. Genetics plays a role as well, but it is rarely deterministic. While a family history of hypertension increases susceptibility, lifestyle and habits remain far more powerful in determining actual outcomes. Studies in Nature Genetics demonstrate that environmental factors often override genetic predisposition, meaning even those with a strong family history can maintain healthy blood pressure through diet, exercise, and stress management. Medications, both prescribed and over-the-counter, can subtly affect readings. NSAIDs, decongestants, and certain antidepressants may increase blood pressure temporarily. Patients often overlook these effects, attributing spikes solely to lifestyle or stress. Awareness and discussion with a healthcare professional allow for adjustments and prevent misinterpretation of trends. One of the most effective strategies for sustainable blood pressure control is the creation of a personalized routine. Consistent sleep, regular exercise, structured diet, and stress management, combined with methodical measurement, produce reliable long-term results. Research from the Mayo Clinic emphasizes that pattern recognition, observing how numbers respond to lifestyle changes, is far more valuable than obsessing over individual readings. Emotional intelligence and self-awareness play a surprisingly significant role. Patients who understand the psychological triggers of their anxiety, stress, and fear often reduce blood pressure fluctuations dramatically. Mindfulness training and cognitive behavioral approaches, as shown in studies in hypertension, help patients decouple emotional reactions from physiological responses, leading to lower average readings over time. Ultimately, the focus should shift from immediate numbers to long-term stability. As emphasized in The Lancet, occasional spikes caused by stress, caffeine, or momentary anxiety do not carry the same cardiovascular risk as persistent, unmanaged hypertension. Patients who embrace this perspective often find that their health improves, their anxiety decreases, and they gain a sense of control that measurement alone cannot provide. As we approach the final steps in understanding blood pressure, it's important to remember that control is about context, not obsession. Patients often enter my office thinking that each number represents a verdict, but in reality, each reading is just a reflection of current physiological conditions, influenced by sleep, stress, diet, hydration, and emotional state. Understanding this distinction empowers individuals to take effective action rather than surrender to anxiety or fear. One of the most transformative realizations for patients is that small, consistent habits outweigh dramatic, unsustainable changes. Walking 20–30 minutes daily, prioritizing vegetables and whole foods, maintaining regular sleep schedules, and managing stress through mindfulness all compound over weeks and months. Studies in Cell Metabolism and Nature Metabolism demonstrate that cumulative lifestyle interventions produce measurable reductions in blood pressure and metabolic risk, often rivaling medication in early stages. A practical example comes from a patient named Lisa, 48, who had fluctuating readings despite a healthy lifestyle. She began journaling her habits, tracking sleep, stress, and diet, and gradually implemented small, realistic changes, reducing sodium, walking after meals, and practicing deep breathing. Within 2 months, her readings stabilized, and anxiety about numbers diminished. This story reinforces that pattern recognition and lifestyle adjustments are far more effective than reacting to isolated spikes. Many patients also misunderstand the role of diet in blood pressure. It's not about perfection, but consistency. Reducing processed foods, balancing electrolytes, and moderating sugar and caffeine intake makes a long-term difference. Research from Harvard Th. Chan School of Public Health shows that sustained dietary improvements correlate strongly with lower systolic and diastolic readings, improved vascular health, and reduced inflammation. Exercise, sleep, stress, and nutrition form the core pillars of blood pressure management, but measurement habits are equally important. Using the same device consistently, measuring at the same time of day, and recording readings methodically allows for a true understanding of trends. The European Society of Cardiology emphasizes that averaging readings over time is far more predictive of cardiovascular risk than any single number, providing reassurance to patients who may otherwise panic. It's also important to recognize external contributors. Environmental stressors like noise, work pressure, and even temperature can transiently affect readings. Awareness and practical mitigation strategies, such as short breaks, calm environments for measurement, and stress-reducing practices, help individuals interpret their numbers more accurately without unnecessary fear. At this point, patients often realize that blood pressure is not the enemy. It's a communication tool. Occasional spikes are normal, and numbers do not define your health. The goal is long-term cardiovascular stability, achieved through consistent lifestyle habits, mindful stress management, proper sleep, and accurate measurement practices. Studies in The Lancet, BMJ, and hypertension all support this approach, highlighting that context and trends matter far more than isolated readings. The overarching lesson is empowerment through understanding. When patients stop reacting emotionally to individual numbers and begin interpreting their blood pressure as part of a bigger picture, both anxiety and risk decline. Preventive health is about actionable knowledge, not fear-based monitoring. Research consistently demonstrates that educated patients who focus on lifestyle, measurement patterns, and stress control achieve the best outcomes over time. In conclusion, high blood pressure should not dominate your thoughts or dictate your emotional state. Instead, view it as a signal, a tool to guide long-term health decisions. By focusing on nutrition, exercise, sleep, stress management, and proper measurement practices, you can stabilize your readings and reduce cardiovascular risk dramatically. The numbers will reflect your lifestyle, but they are not your identity. So remember, the next time you see a slightly elevated reading, pause, breathe, and consider the bigger picture. One number does not define you. Focus on sustainable habits, monitor intelligently, and manage your stress, because these factors, not panic, truly influence your long-term health. Your blood pressure is a guide, not a verdict, and by respecting the signals your body gives you, you can live healthier, calmer, and more empowered than ever before. High blood pressure is not a sentence, it's a signal, a guide, showing how your body is responding to lifestyle, stress, and daily habits. Over my 32 years of practice, I've seen many patients panic over a single high reading, only to discover later that consistent habits, balanced diet, proper sleep, regular exercise, stress management, and mindful measurement matter far more than isolated numbers. Research from The Lancet, Hypertension, and the American Heart Association confirms that long-term trends, not occasional spikes, predict heart and metabolic health. When you focus on these sustainable actions rather than reacting in fear, your body stabilizes naturally, your anxiety decreases, and your overall well-being improves. Remember, numbers fluctuate because of temporary stress, hydration, or even the time of day. What defines true health is your daily choices and consistency over time. And while these strategies help you take control of your blood pressure, the journey is easier when you stay informed and share your experiences. If you found this video helpful or learned something new, consider subscribing to the channel for more practical health insights, and leave a comment sharing your own strategies or questions. Your story could help others take control of their health too.